discipline of ear, nose, throat surgery, the emergencies that are usually encountered depend on the system that you're looking at. So if you're looking at the area of the nose, then you have got nosebleeds, which can be quite devastating and life-threatening. We also have acute airway obstruction, as can occur especially when one inhales a foreign object, and this then lodges in the main airway tract. That can then lead to an emergency that can very easily lead to death. The other emergencies are usually, again, ingestion of a foreign body that then, instead of lodging in the airway, then lodges in the food tract. And the one that we're most worried about usually is the baton batteries. Now, these are usually quite common within most of our households, and they're the sort of batteries that are found in your watch, your calculator, and for people who use hearing aids, within your hearing aids. And these batteries, when ingested, they're very caustic, and it's basically made of an alkali. That we find that within 1 hour of the child ingesting this particular foreign object, you have erosion of the lining of the food pipe. So within a very short time, you will then find that the child is having extremely severe symptomatology in terms of pain, and this can lead to what we refer to as mediastinitis and a perforation, in fact, within the food pipe. And this is a grave emergency, and so I have to hasten and give a word of advice to our clients that some of these things need to be kept well away from children. The other emergency that we tend to find again when you look about the ears is what we refer to as sudden sensorineural hearing loss. And this is a situation whereby what you will experience is within a very short period of time, duration, maybe 1 to 2 hours, you suddenly lose your hearing. Or when you wake up early in the morning and you cannot hear. This is never normal. This is never something to be to say that it'll come to an end or it'll pass over. You need to seek treatment. If you suddenly cannot hear, that is an emergency that one needs to be able to see a doctor who can be able to address it and be able to preserve their hearing. So those are the main ENT emergencies that we do encounter. Most of the others can be classified as urgencies, in that as much as they do require one to address it in a timely fashion, but they will at least allow one to be able to plan for the surgery, and they tend to be not as life-threatening or not as threatening to one's general well-being as the 4 that I've mentioned prior. We'll look at them, each of the emergencies that I've spoken about earlier, and we'll just briefly touch on how we manage them. So for acute airway obstruction, it is very important that we as the members of the public can be able to notice it, because many of these people, when they succumb to this sort of conditions, they do so before they reach to a medical specialist. So if it's an older child or an adult, more often than not, if he starts having a bout of coughing, gagging, choking, many a times they do actually point to their neck or grasp at their neck. And they always try and tell you that I'm having difficulties in breathing. And for this, first and foremost, if you notice this, is try and stay as calm as possible, because this will also reassure the patient. Try and sit them down if you can, or stand them up. And the Heimlich maneuver, I think, is something that should be taught in our places of worship, in our schools, in the wait staff at restaurants should be able to come to your assistance. And usually what they intend to do is, during the Heimlich maneuver, you want to be able to exert some pressure, especially at the region of your tummy. And it is a pressure that is applied, it's a thrust, and this will at times enable the patient, to be able to expel the object that is causing the obstruction. This can be food stuff, this could be things that range from coins to other objects that are usually found, or toys, within our household. When they come to us as ENT specialists, then we have to go and extract the offending object from the airway. And this is usually done endoscopically by the use of something we call a bronchoscope. And it's usually done under anesthesia. So the most important thing usually is to try and secure the airway, make sure that the patient is breathing, and then to extract the offending object. So when it comes to ingestion of baton batteries that then lodge in the food pipe, it is unfortunately at times this can occur, especially with the younger children, without any adult being present. So that has not been picked up. But when they come to us, the management is usually extraction of the object and a direct visualization through something we call rigid esophagoscopy. Again, this is a procedure that has to be done under anesthesia. Now, for patients who come to us with sudden sensorineural hearing loss, then the first thing is to be able to establish that the person is actually having a hearing problem. So you probably will have to undergo a hearing test. And if we can be able to find out exactly what caused the hearing loss, then there are various medications and management protocols in place to mitigate against some of the most common offending etiologies. This can range from some viral infections to trauma, like if a patient has had a road traffic accident or something of the sort and has had a fracture that involves the bone that houses the hearing apparatus, then they actually require surgery to be able to ameliorate some of these effects of the sudden sensorineural hearing loss. And when it comes to nose bleeding, or what we refer to as epistaxis, then a vast majority of times that this occurs, especially in children, we're not quite sure why it does occur. And that is what we call idiopathic. But the next most common reason is actually trauma, mostly from nose picking. So you'll find a child maybe has a flu or a cold and has got snot and so forth in his nose, and they would want to try and remove this, and they use their fingers. The lining of the nasal airway is quite thin and flimsy, and the nose is so well vascularized that you'll find that the blood vessels run quite superficially. So when the child keeps on putting his or her finger into their nose, then you'll find that this leads to repeated trauma, abrasions, and injury to some of these very, very thin-walled blood vessels. And then this can lead to, at times, quite frank bleeding. At times it could just be some bit of spotting in the snot as it comes out. and at times can be extremely torrential bleeding from the nose. So what do you do before you get to hospital when you have a patient such as this? The first thing is to try and sit the patient down, have his neck in what we refer to as a flexed position. So flexed means that the chin comes towards the chest, something sort of like this. Most people, what they tend to do is to have it extended, which means that the back of the head goes towards their back. And this is not the right thing to do. So have it come down. And what you want to do is to take your index finger and your thumb and to pinch the soft part of the nose. And you pinch this for a couple of minutes. And usually, more often than not, this sorts out most of the acute nasal bleeds. People have found also at times maybe getting an ice pack and putting it over one's forehead or at the bridge of their nose, or taking an ice cube and putting it in their mouth and sucking on it helps in causing what we call vasoconstriction. And this is whereby the blood vessels, just because of the decreased temperature, then sort of constrict and can be able to stem the bleeding. When some of these first aid measures do not work, then you clearly have to then seek medical attention. And when it comes to this, then there are various treatment modalities that can be executed. The very first one could be to do something called cauterization. And cauterization can either be chemical or electro. And in chemical cauterization is where we apply certain chemicals to the lining of the nose. We tend to use a lot of silver nitrate. And when the nitrate comes into contact with the moisture within the nasal cavity, it forms nitric acid. And then this can seal some of these bleeding vessels. Electrocautery is whereby we use electricity to cauterize these vessels. And basically what we're trying to do is to ensure that the vessel collapses and stops the bleeding. When some of this do not work, then surgery is indicated.